Hello.
Hi.
Thank you for meeting with me today.
Sure.
And your name is?
Mary Roberts.
Mary Roberts. Nice to meet you. We're just going to sit and have a small conversation
Okay.
about any topic of your choice. I know you mentioned healthcare is concerned, so if you want to speak about that, we can talk about that for a little bit, any of your
Sure.
concerns.
Okay. Yeah, I do have concerns about healthcare, especially since I'm getting older and the costs are going up all the time.
Yeah.
And I know my husband is on some medication, then he's in a donut hole, and we have to pay a large amount several times a year. So I have a lot of concerns, and I know there's a lot of people out there that can't afford insurance.
Mm-hmm.
I'm worried about the handicapped and their insurance, that it won't be there for them,
Mm-hmm.
and it's a real issue. I don't know what they're going to do about it because they definitely need insurance. So,
Right.
I have a daughter that is handicapped, and I kind of am concerned about because they can't afford to pay a premium
Mm-hmm.
on their own. And like my friends, their healthcare insurance, we all talk about it's going up.
Mm-hmm.
And so is it going to be one day that it's more than what you can afford, and what are you going to do then?
Right.
I don't know what they need to do for sure, but I think their main concern is they do need to look here after the elderly and the handicapped. And I think they always look after children, small children, make sure
Right.
that they've got some kind of health care benefit. But
Right.
it's the other people, we can't let just people go without insurance, because then who pays for, it's going to come out somewhere.
Right.
You can't financially devastate people because they can't afford insurance, and then they have a huge medical bill.
And they have to choose between what they want done and what they can afford.
Yes, yeah.
And with having a child that is handicapped, are you afraid of the financial burden falling on you because she cannot pay a premium?
That's a small concern. I guess we would look at that whenever the time came, but I worry that if something happens to us, that, who's going to look after her?
Right.
Will they just be a forgotten bunch of people that,
Right.
What's going to happen to them? Are they just
Right.
going to be sick and no one takes care of them? I don't foresee that really happening in the United States, but there's been other things that have happened that you think, oh, I never thought that would happen.
Very true.
Years ago, companies really did look after their employees and had good health care and health care insurance. And even after you retired, you were able to afford the insurance. And now it's too expensive for companies to even try to, some companies don't even have insurance. And a lot of companies, their insurance they do offer you is not a good policy.
Yeah.
You have to end up paying a lot out of
It's a
pocket.
lot of money.
It is a lot of money. And then when you retire, you're just kind of like left on your own to find whatever you can for a policy.
You can afford, yeah.
Mm-hmm.
And I know you worked in a little bit of healthcare being a receptionist.
Mm-hmm.
Did you ever experience that while working, that patients denied something being done?
No, I don't think that ever happened that I know of, but I do know that the pharmacy would have to call back a lot of times and say, this medication's too expensive, the patient can't afford this.
Right.
And really, when they tell you how much it was, no one could afford it. I don't know who could, other than the really ultra rich could afford it, and I don't know that they would even pay that much money for a drug. And the sad thing is then, drug companies go, well, we have a program, well, make it affordable for everybody.
Mm-hmm.
I mean, I'm glad there's programs for people that really can't afford, but usually those people are really, really desperate, and stuff. So what happens to the other people? Do they just eventually get desperate?
Mm-hmm.
I don't, it's kind of sad in this country. It's that things have went the way they have. That everything is so overly expensive to have anything done. Um, I grew up. My dad was a farmer in the 50s. My mom didn't work, and they didn't have health insurance. And anything that happened, they were able to afford to pay for it themselves.
Out of pocket and support 7 kids.
And 7 kids. They had 7 kids. Never had any health insurance. Paid for. Mom went to the hospital every time. They paid for
whatever they needed.
Get whatever they needed, and then by the late 60s, it just started. She started working and got insurance, and things were really good for a long time. And even my mom, when she retired from the university, they had really good health plans for them. But then eventually, that cost went clear up too, to where she was looking for other affordable insurance.
Right. Times have definitely changed, especially in healthcare.
Yes.
It's definitely an interesting conversation to have with a lot of people because there's really no great answer across the board. Have you thought about the single taxpayer or the single payer systems, or do you have any ideas about the health care reform?
No, I guess no, I don't know. I just, my husband and I did find policies that we felt like we could afford, and so far they've met our needs. But like a lot of our friends, their insurance just keeps going up and up all the time. Like one friend yesterday said that they pay $1,200 a month, and it's like, well, they couldn't afford $1,200 a month.
No way.
Yeah. So
it's outrageous. Especially if you're retired, because you're going to have a fixed income.
Yeah. So, like my husband's, like I said, some of his medications now that he's in a donut hole are really expensive, and he was like, well, then I just won't take them. And I said, well, then there you go. You'll end up having some kind of health issue that's going to cost a lot more money than, what you would have paid for this medication.
Yep. And that's the fear they instill into people. That's why med prices keep going up, because people are too afraid of getting sick. So they keep spending more money because people need the drugs. But it doesn't help when you don't have the money to do it, and you just end up more sick, which costs the healthcare system even more money.
Yeah.
So it needs to start small and work our way up.
Yeah. I mean, I think we have a good health care in this country. It's just the affordability of it all, and I don't know why the prices have went up so much in the last 20 to 30 years compared to what they were before, that people could afford, to have insurance or afford not to have insurance and be able to pay. And now it's like one thing would devastate you if you didn't have the insurance.
One ambulance ride could wipe out your entire life savings.
Yes. Yeah.
Which is insane. That simple things you can't even think about because it would just wipe your savings out.
Yeah. So I don't know. I mean, then you're going to have a whole country of welfare, and
it's going to cost even more money on the system.
Yes. Yeah.
So in the end, it's still going to cost money to the system.
Yeah. Yeah. It's kind of a vicious circle. It really
not saving anybody money but the drug companies that are making the money. So.
Yeah. Yeah. There's got to be a solution somehow.
Yeah.
So.
Hopefully that can be figured out sooner than later.
Hopefully,
because it's just going to become a never-ending pit.
The money pit, right? Yes. It is, and that's sad. It's like, you try to do everything to stay healthy,
right?
But that doesn't mean you will, or there's always accidents happen, and so
things happen without your even. Nothing you did wrong, and they still happen.
They still happen out of control.
You have to deal with it.
Out of your control. So yeah, you have to deal with it and go on. And I just think that, especially you're getting older, that your life should not have to be worried about,
being able to pay for your meds.
Yeah.
Go enjoy your life rather than worrying about being able to make enough money to live.
Yeah.
when it comes down to it.
Yeah, you know, being able to still do the things you like to do and be able to eat
Yeah.
instead of, you know, choosing medication,
For
overeating.
basic
Yeah,
necessities.
yeah. So anyway, I don't know. I I feel like that the people that are in government, it's really something they need to look into. And of course, there's never going to be an all-around answer that's going to serve everybody and help everybody,
Right.
because one person has this issue, another person has another issue. So sometimes you can see both sides of the coin, and hopefully, though, that there's going to be enough good people that will elect in that can see that things need to be changed.
Yeah, definitely needs some reform.
Mm-hmm.
All right, well, I appreciate you sitting and talking with me today.
Okay.
That's all.
Okay, thank
Thank
you.
you.